Although breast augmentation is an operation that produces delighted patients, it can occasionally be accompanied by firmness of the breast after surgery. This usually does not happen in my practice, only about 4% of cases, because of the multiple things done in the operating room that reduce the risk of contracture. These would include placing the implant behind the pectoralis major muscle, soaking the implants in antibiotic solution, washing out the area where the implant will go with antibiotic solution, administering intravenous antibiotics to the patient, and preventing contact between the implant and skin when I insert the implant by use of a sterile plastic skin covering. When firmness does occur, though, how do I treat it? Well, first of all, firmness of the breast is not caused by a hardening of the implant. When one removes an implant in a patient with firmness, the implant is still very soft. Firmness results from a contracture of the scar tissue that's present around every breast implant. As this scar tissue squeezes down on the implant, it becomes firm to touch. It is sometimes painful and usually changes the implant from a soft pillow to a hard ball. To treat the firmness, the first thing I do is to start the patient on Accolate, an asthma medication, and this tends to relax the contracture. This off-label use of Accolate may be successful, but if it's not working after 3 months, we may want to consider an additional operation to release the contracture. If the contracture started right after surgery, a simple incision of the scar tissue will release the tightness and may be all that's required. If the contracture started years after the surgery, it will usually be necessary to surgically remove the scar tissue and change implants as well. If the implant is not behind the muscle, I like to move it there, since this will help to prevent a return of the contracture. Now, what happens if none of these steps are successful? There's now something available known as an acellular dermal matrix and marketed as Alloderm or Stratus. This is nothing more than skin from a human or a pig. It's been treated so as to remove all cells so that just the collagen framework remains. This can be used in surgery after the scar tissue is excised to cover the part of the implant that is not covered by the muscle. Studies are showing that this may be of help in preventing the return of the contracture. It's fairly expensive, however, so that I usually reserve this for cases of contracture that do not respond to simple removal of scar tissue. Although firm breast after breast augmentation are troublesome, it usually does not occur, and if it does, can be managed to what is usually a successful conclusion. This is Dr. George Sanders.